You're listening to Dr. Erica Jones, MD. The universe needs conscious minds to observe it.
I am a physician, and I've been on both semaglutide and tirzepatide. I prescribe these medications, and I understand the results of the trials, but I also wanted to understand how they feel in my body. So stay with me. I'm going to talk about my personal experiences. Because when we talk about weight, like, we're not just talking about numbers. We're talking about stress. We're talking about hunger. We're talking about cravings. We're talking about exercise. We're talking about energy, nutrition, and how your brain and your gut are actually connected and how they communicate on a day-to-day. I'm Dr. Erica R. Jones, MD. If you haven't already, make sure you subscribe to my channel and like this video. But first, let me get a little nerdy. I'm going to talk about some hormones. GIP is called gastric inhibitory polypeptide, and GLP-1 is glucagon-like peptide 1. These are two hormones in the incretin class of hormones. They're secreted from the intestine after you ingest glucose or nutrients, and they stimulate insulin secretion from the pancreatic beta cells. These are two different hormones. GIP and GLP-1, they exert their effects by binding to their specific receptors. So you have a GIPR or GIP receptor, and then you have a GLP-1 receptor. And both of them belong to the G protein coupled receptor family. So understand that these are two different hormones, right? So I don't know if you watched my live or not, where I talked about the major differences in between semaglutide and tirzepatide. Essentially, semaglutide works on one hormone, and that's going to be GLP-1. It slows digestion, lowers appetite, and improves blood sugar. That is semaglutide. Think about it like this. Semaglutide works on a single hormone. Tirzepatide starts with a T. It works on two hormones, GLP-1 and GIP. Both of these is what happens when you use the tirzepatide. And just remember, tirzepatide works on both of these. So you're actually packing like instead of just that one little jab. So think about the number 2 when you think about tirzepatide. Both of them start with a T, right? So give me a moment to just delve into this a little bit deeper. GLP-1 is like the classic satiety hormone, right? So it's going to tell your brain that you're full. It's going to slow your gastric emptying, which means it's going to slow down, how fast food leaves your stomach. It's going to help your pancreas release insulin when your blood sugar rises. And that's why semaglutide is able to reduce hunger and then stabilize your glucose so well. Now, we're going to talk about the other hormone, GIP. Now, this is the second hormone. Like I said, tirzepatide acts on two hormones. So GIP is the second hormone that tirzepatide is going to activate. And it actually works more than just like as an insulin booster. So in the brain, GIP receptors are found in key appetite centers, like in the hypothalamus, in the brainstem, in areas that regulate hunger, fullness, and even nausea. Look at the data if you haven't already. I definitely looked at the data as a physician. So preclinical and clinical data suggest that the dual GIP and the GLP-1 agonism, it leads to greater weight loss than GLP-1 alone. And that's because it hits more pathways at once. So think about that, boom, boom. It's hitting more pathways at once than the appetite, the insulin sensitivity, and even how your body burns fat is going to change with tirzepatide. And that's the idea behind its design. Like I said, with semaglutide, you got that single loop, boop, that one little jab. So just think about that. The tirzepatide is going to result in more coordinated metabolic effects, right? Now, I'm telling you, as a physician, that I've taken this medication. If you have any questions in the comments, make sure you drop them down so I can see. But personally, I can say that my hunger signals were quieter, the food noise was quieter, my blood sugar control was smoother. I didn't have those crashes, and my weight loss was more consistent on Tirzepatide. And that lines up with what we've seen in the trials. You know, Tirzepatide generally leads to greater weight loss and A1C reduction as far as the studies are concerned. So when I tell you that I prefer Tirzepatide, just understand that this is a personal preference. Every person is different. Everybody's going to have a different experience. When you talk about the trial data, there's a trial called the Surmount-5. So it's like a head-to-head trial where they put Tirzepatide up against Semaglutide, and the adults with obesity or who were classified as overweight on Tirzepatide, they lost an average of 20.2% of their body weight over 72 weeks. So just think about it. You lose 20% of your body weight over 72 weeks. And we know that's longer than a year, but that's some pretty good results. But then those people on semaglutide lost about 13.7% on average. So if you think about it, Tirzepatide produced almost about half more relative weight loss in the direct comparison, so about 47%. And then more importantly, 31.6% of people on Tirzepatide achieved at least 25% body weight loss compared to 16.1% of those on semaglutide. So these are some really big numbers. I know I just spit out a bunch of statistics, and it's nothing wrong with the weight loss that people experience from semaglutide. I'm just merely saying that Tirzepatide produced more weight loss, and those extra pounds lost actually translated into bigger improvements in waist circumference, blood pressure, and lipid levels, all of which are key cardiometabolic risk factors. If you don't understand risk factors, let me know in the comments. I can explain that a little bit more. But one of the things that I want to emphasize is the difference is not just about the scale and like the numbers that the medications are producing on the scale. It's about the whole metabolic picture. And some people say, well, Dr. Jones, I see that, people are selling both semaglutide and Tirzepatide. If you have not noticed, Tirzepatide is typically more expensive. But then you got to ask yourself, is it worth paying this money? You say, well, why does Tirzepatide outperform semaglutide? It's because it's not just stronger, it's working differently. Remember what I said, Tirzepatide is going to pack that boom, boom, versus just that one little jab that semaglutide is going to provide. So at the end of the day, only you know how different medications are making you feel. So if you feel like you are on semaglutide and you want different results, you could talk to your provider and ask them if they feel comfortable shifting you over to Tirzepatide. And if you're on Tirzepatide and you feel like you're having different side effects that you don't necessarily want to experience, ask your provider to switch you. Now, one of the important things to know is that you have to have a conversation with your provider. You have to let them know what is going on. If you don't let them know what's going on with your body, then it's like, well, how can someone help you? Just remember this. Both drugs are going to reduce the caloric intake by lowering the appetite. But Tirzepatide has dual action. It acts on GIP and it acts on the GLP-1s. So it might create a more favorable energy balance for you. That is one of the reasons why some people will choose Tirzepatide over semaglutide. Now, we can't forget about money, right? Especially in these days and times. It's important to understand that semaglutide is typically going to be cheaper than Tirzepatide. So there's this question of access. But at the end of the day, you need to know the facts. So I'm bringing you my personal experience as a physician. One of the other things people don't emphasize, a lot of times, is that appetite is not just in the gut. Appetite is also wired into the brain. The GLP-1 receptors are concentrated in different brain regions that control our hunger and reward systems. We're talking about the hypothalamus. We're talking about the brainstem. So when we think about the GLP-1 agonists, they're going to reduce the cravings and the portion size. They are powerful, right? But the GIP receptors are also present in the overlapping and distinct brain areas, including the hypothalamus, the area postrema, the nucleus tractus, solitarius. These are all involved in feeding behavior and nausea and energy balance. So once I really emphasize this, by the end of this video, you're going to understand that tirzepatide is stronger than semaglutide. You have all these different receptors that tirzepatide is going to affect. When you think about the receptors, right? So the GIP and the GLP-1 receptors are not always on the same neurons. So tirzepatide is going to be able to, affect a broader network than semaglutide alone. So boom, 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 boom. That's what the GIP is going to do for you. GLP might offer that little jab if you think about that. So what's important is that you get the results that you want. You're improving your health while you're taking these medications. You don't hear a lot of people talking about the side effects, but there's some things that I think that are important to mention, right? Just because tirzepatide is stronger, it doesn't mean that it's automatically better. Some people experience more GI side effects when they're taking tirzepatide versus semaglutide. So other people do better on semaglutide. It just really depends on who you are, and I encourage you to keep track of your symptoms that you're having, if any. If you don't have any symptoms while you're taking these medications, then that's great. But the most common symptoms are going to be, some moderate GI issues, so like nausea, diarrhea, some constipation. And most people experience these when they have like a dose increase. But when you think about tirzepatide, it's more potent. So some people may have more serious GI side effects, especially when they get to those higher doses. It's just important to understand that taking these medications is really about, what fits you, your lifestyle, and your health goals. It's not about any hype. And then everybody's completely different, right? So you might not have the side effects that someone else has, but it's important to keep track of all of that, right? This is about your own personal, your health, nobody else's. Your friend might have different results than you have. Your cousin might have different side effects than you have. It's just important to know that people aren't a monolith, right? People aren't. So I can talk more about this if you want me to. Just let me know down in the comments if you have any questions. Let me know if you want me to address anything else while I'm talking about these medications online.